I'm Dr. David Beaulieu, and I'm back with more news you can use. And I want to talk to you a little bit more today about aluminum. I know we've talked about this in the past, but I think it's a very, very important subject because it keeps coming up in the scientific literature. We don't know how much is dangerous. We don't know how much it takes to create a real problem. We don't know that the body doesn't use it. We do know that it's toxic. We do know that it creates a problem. You get it in your food in aluminized baking powder. Our baking powder we get at Whole Foods, and it has an extremely low aluminum content. We're very, very careful about that at my home. Highly processed cheese products are actually, aluminum is actually added to them because it improves their melting ability. Geez, that's scary. A lot of things are packaged in aluminum. Stay away from that. Whatever you do, don't microwave anything in an aluminum container. I know some people do that. Don't cook in aluminum pots and pans. Our kids now receive over 60 vaccines by age 6, most of which now contain aluminum hydroxide. And because aluminum hydroxide is one of the antibacterial agents used. They talked about using that because they phased out the mercury. Well, they haven't phased out the mercury. They're still using thimerosal, in spite of the fact that the big pharmaceutical companies said they weren't going to do that anymore. But now we get a combination of mercury and aluminum. Isn't that delightful? But we're injecting that into our children and not thinking a whole lot about it. Maybe we should. Deodorants, antiperspirants, very, very important, not so much for us guys, but for you ladies, because there's a definite connection between aluminum in breast cancer cells and the aluminum that you get through the skin into the lymphatics around the breast when you use antiperspirants that use aluminum hydroxide. Aluminum cans, we've talked about aluminum cans. I don't care whether it's cola or it's beer or it's a juice. Don't drink from aluminum cans. It doesn't make any sense. Aluminum degrades, and you get a little bit of aluminum every time you do that. Even parenteral nutrition, intravenous feeding with newborns. A recent study, 2010, in the Journal of Pediatric Gastroenterology and Nutrition demonstrated that parental nutrition resulted in aluminum exposures that exceeded the FDA recommended maximum limit. And we find it in infant formula. It's not okay. We must be more vigilant. Our government and our scientific organizations are not taking care of us. They're taking care of big business. That's where the money comes from. It doesn't come from you and I. Be vigilant.